Mr. Wood is coming to the oncology department tomorrow to see his oncologist. The nurse phones him the day before to see if it's okay that she attends his consultation. He's participating in a research study and she wants to collect some qualitative research data from him and his wife. When the nurse phones Mr. Wood, the wife answers the phone and said that he's a bit poorly to speak to them at the moment, but she's more than happy for the nurse to attend the consultation tomorrow. Mrs. Wood is worried that Mr. Wood's health is deteriorating rapidly. She has some questions she wants to ask the doctor, but she doesn't know if she's allowed to do that or not. Fundamentally, she knows her husband's deteriorating and wants to know how long he's likely to have left, what to expect as his health declines, because she's not sure how to nurse him. She wants to know what support she's going to get. But also, really importantly, she wants to know if she should bring her daughter home from the States so that she can say goodbye to her dad before he dies. In contrast, though, Mr. Wood's son would rather the mum didn't ask any of these questions because he doesn't think his dad wants to hear this information and has asked his mum not to say anything. So she's in a bit of a conflicted situation.
Hello?
Hello, Mrs. Wood.
Oh, yes.
Hi, it's Lynn.
Oh, hello, dear. Are you all right?
Yes, I'm fine, thank you. Are you?
Oh, yeah, you know what it's like, plodding on, dear, you know.
Oh.
Yeah.
Well, I know you've got a busy day tomorrow because you're coming into the hospital, aren't you, to see Mr. Jones?
Yeah.
I'm just wondering, are you still all right if I come along and sit in and observe your consultation again with you and Mr. Wood?
Oh, yes. I mean, I'd want you to be there. You're part of the family now, aren't you?
Oh, thank you.
Yeah. Oh, please, if you wouldn't mind, I think that will be... Yeah, thank you.
All right. So I'll see you tomorrow then, unless you've got anything you want to ask me now or talk around.
I mean, have you got time?
Yeah, I've got time for you.
Oh, sorry. It's a bit hard, really, because I can't really talk about this at home with him, you know, because he don't really want to go there, you know. He don't want to talk about his illness, really, and I know our son knows that, so nobody's really talking at the minute about what might happen. Sorry, I've been silly now, haven't I?
You're not silly, just take your time. What's the main thing that's worrying you?
Oh, well, I'm worried I don't know what to expect, really. You know, I don't know how I'm going to be able to care for him at the end, and I don't know what's going to happen, I honestly don't know how long he's got. You know, what to expect at the end. And I need to know. And I think I'm really sorry. If only I could talk to him, if we could talk together as a family, and we can't because it's so difficult. I don't want to upset him. You know, he's so important to me. I just want to do what's right by him, really, but I'm finding it really difficult. I'm not sleeping very well. I'm so worried. I'm so sorry. Take up your time.
Oh, Mrs. Wood, you don't have to apologise to me. It's difficult, isn't it? I know Mr. Wood doesn't really like talking about his illness. And I know that you've had questions along the way that you've wanted to ask that have been difficult to ask. And I can really hear in your voice that this is really, that there's a great burden on you at the moment, I think.
It is a little bit. He's not a burden for me. I'd do anything for him, you know I would. It's just the fact it's a burden. when you can't sit down and talk about it. I can't tell him how I'm feeling. He won't say how he's feeling. And my son's like trying to protect the pair of us. It's all a bit of a mess, really, dear. I don't know what to do.
It's all a mess.
Yeah. You know, having the illness himself, you know, having all that to put up with is bad enough, but, you know, I think we've just got to try and talk to each other a bit.
And so I get the sense that there's a breakdown in communication here, and that you feel the need to talk as a family, but that's not quite happening. And you're worried that Mr. Wood's condition is deteriorating, and you want to know what's going to happen in the future.
Yeah.
And based on that, I'm wondering, what can we do to help tomorrow when you come to the clinic? What would be useful for you?
I think, I don't know really. I mean, it's really good that you're going to be there, but maybe I've got to pluck up the courage to say something while you're there, if you don't mind, and say to him, look, I don't think we talk, and I think maybe he just don't want to face up to it, really. He don't want to give me the worry either. He don't want to see me upset. So I think we're all going around trying to protect each other, and it's quite painful for all of us, isn't it, really? It's probably making it worse.
Yeah,
do you think that might help?
I think, yes, I think it will help if we can have that conversation tomorrow. You're a close family, aren't you? And you all love each other so much that I get the sense that, you know, it's really important, that protecting each other, but sometimes we do need to have those difficult and challenging conversations. But I suppose that has to be at a point where we're all ready to have that conversation.
Well, it made me feel safe. It made me feel really cared for, you know, genuinely cared for. And I got the idea that, you know, she knew that I was holding something in. Well, she was so patient, you know, she just waited for me to say what I needed to say. She gave me so much time, and then she was so kind and acknowledging. You know, it just made me want to say everything to her, really.